What if the biggest danger in cosmetic surgery isn't the procedure itself, but the decisions you make before it? Rushing into cosmetic surgery is one of the most common mistakes people make, yet it is often underestimated. The decision to alter your appearance surgically is not something to be taken lightly, and acting on impulse can have serious consequences, both physically and emotionally. Many people are influenced by immediate desires, an upcoming event, a trend they see online, or simply dissatisfaction with a feature they want to change. These motivations, while understandable, often lead to hasty decisions without the proper preparation, research, or reflection. Surgery is irreversible in many cases, and rushing into it can result in outcomes that may not align with your expectations. The first step toward avoiding this mistake is understanding the procedure itself. What exactly does it involve? What are the potential risks, side effects, and complications? Each surgery comes with a different set of challenges, recovery times, and realistic results, and ignoring these details can set you up for disappointment or worse, serious medical issues. Beyond the procedure, it is crucial to evaluate the qualifications of the surgeon. Credentials, experience, and patient reviews are essential factors that require careful consideration. Many people make the mistake of assuming that any licensed surgeon is equally capable, but expertise in one procedure does not automatically translate to expertise in another. Researching the surgeon's track record, asking for before and after photos of previous patients, and even consulting multiple professionals can provide clarity and confidence in your choice. Another important aspect of avoiding a rushed decision is reflecting on your motivations. Cosmetic surgery should ideally be a well-considered choice made for yourself, rather than for anyone else's approval or to fit societal pressures. Impulsive decisions are often influenced by external factors such as trends on social media, peer comparisons, or the desire to quickly fix perceived flaws. Taking the time to pause and assess whether the surgery aligns with your personal goals can prevent regret later. Additionally, understanding the financial and logistical commitments involved is part of thoughtful preparation. Many procedures require follow-up appointments, medications, downtime, and sometimes adjustments or revisions. Rushing into surgery without acknowledging these responsibilities can create unnecessary stress and complicate recovery. The mental and emotional readiness to undergo surgery is as crucial as the physical preparation. Feeling anxious, pressured, or unsure can affect decision-making and even the recovery process. Taking time to educate yourself, consult professionals, and reflect on your personal readiness is not just recommended, it is essential. Engaging in conversations with people who have undergone similar procedures, reading credible medical sources, and understanding both the limitations and potential results of surgery helps create realistic expectations. In short, patience and preparation are vital. Avoiding impulsive decisions ensures that when you do move forward, it is with full awareness of the procedure, its risks, the surgeon's expertise, and your own emotional preparedness. By committing to thoughtful research and reflection, you increase the likelihood of a positive outcome and reduce the chances of regret, complications, or dissatisfaction. Prioritizing surgeon quality over cost is one of the most critical decisions you can make when considering cosmetic surgery, yet it is a mistake many people overlook. The allure of a lower price can be strong, especially with the proliferation of discounted procedures advertised online or promoted through social media. It is easy to think that a more affordable option will yield the same results, but in reality, choosing a surgeon based solely on price can have serious consequences for both your health and the outcome of the procedure. Cosmetic surgery is not a product, it is a complex medical intervention that requires skill, precision, and experience. Every procedure involves potential risks, ranging from infection and complications during surgery to unsatisfactory results that may require corrective procedures. When a surgeon is inexperienced or cutting corners to reduce costs, the likelihood of these risks increases significantly. The credentials and experience of a surgeon are essential factors to consider. Board certification, specialized training, years of practice, and a history of successfully performing the procedure you are interested in are not optional. They are critical. A highly skilled surgeon may charge more, but this cost reflects years of education, practice, and the ability to handle unexpected complications. Investing in a qualified professional is an investment in your safety and in achieving the results you desire. Many people also underestimate the importance of seeing before and after photos of previous patients and reading reviews from trusted sources. These tangible examples provide insight into the surgeon's skill and consistency and allow you to assess whether their style and outcomes align with your goals. A cheaper procedure might look appealing on paper, but if the results are unpredictable or require revisions, the total cost, financially, physically, and emotionally, can far exceed the initial savings. Additionally, quality surgeons often maintain high standards for hygiene, equipment, and patient care. Cutting costs may mean that the facility is not properly accredited, that anesthesia is handled by less experienced personnel, or that post-operative care is inadequate. All of these factors directly affect your safety and recovery, yet they are often overlooked when the focus is only on price. Another important consideration is the psychological impact of choosing a lower cost option. Experiencing a subpar outcome can be emotionally distressing and lead to regret, self-esteem issues, or the need for corrective surgeries that are more expensive and complicated. Understanding that quality is not negotiable helps set realistic expectations and encourages a more deliberate decision-making process. It is also worth noting that investing in a reputable surgeon may provide additional benefits beyond the immediate procedure, such as thorough pre-surgery consultations, personalized planning, and attentive follow-up care. These factors contribute to a smoother recovery, better results, and peace of mind throughout the process. Ultimately, focusing on surgeon quality over cost is not about extravagance. It is about making a responsible choice that prioritizes safety, results, and long-term satisfaction. Being diligent in evaluating credentials, experience, facility standards, and patient outcomes ensures that your decision is informed and aligned with your goals, rather than motivated by short-term savings. Assessing your mental and emotional readiness before undergoing cosmetic surgery is an often overlooked but absolutely essential step. Many people focus exclusively on the physical aspects of the procedure, the technique, the surgeon, the cost, and the expected results, without taking the time to consider whether they are psychologically prepared for the experience and its aftermath. Cosmetic surgery is not just a physical intervention, it also has profound emotional and psychological implications. Entering a procedure without emotional readiness can increase the risk of dissatisfaction, anxiety, and even depression post-surgery. Understanding your motivations is the first aspect of assessing readiness. Are you pursuing surgery to address a genuine desire for self-improvement, or are you reacting to external pressures, social trends, or unrealistic standards of beauty? People who make decisions based on the opinions of others, such as friends, partners, or social media influences, often find that the results do not bring the satisfaction they expected. Emotional readiness involves a deep level of self-awareness and honesty about why you want the procedure and what you hope to achieve. It also requires realistic expectations about the outcome. No surgical procedure can guarantee perfection or fundamentally change your life circumstances. While cosmetic surgery can enhance features, correct asymmetry, or improve confidence, it does not solve deeper issues such as low self-esteem, relationship challenges, or unresolved emotional trauma. Patients who are not mentally prepared may focus excessively on perceived imperfections, leading to disappointment or even the desire for multiple unnecessary procedures. Another key factor in emotional readiness is understanding the recovery process and the potential stress it can impose. Surgery often requires time off work, restrictions on daily activities, and patients as swelling, bruising, and healing occur. Being mentally prepared for these temporary inconveniences is critical because frustration, impatience, or anxiety during recovery can negatively affect both physical healing and emotional well-being. Additionally, considering your support system is an important aspect of readiness. Having friends, family, or caregivers who can provide assistance, reassurance, and honest feedback throughout the process can make a significant difference in your experience. Emotional preparedness also includes the ability to make decisions independently and confidently. Surgeons can provide guidance and advice, but ultimately, the choice must align with your personal goals and comfort level. People who feel pressured or uncertain are more likely to experience regret or emotional distress afterward. Seeking professional guidance, such as consulting with a counselor or psychologist before undergoing cosmetic surgery, can be invaluable for evaluating your readiness. These professionals can help you explore your motivations, set realistic expectations, and identify any underlying emotional factors that could influence your satisfaction with the results. Taking the time to assess mental and emotional readiness is not a sign of hesitation or weakness. It is a crucial step in ensuring that the decision to have cosmetic surgery is informed, deliberate, and aligned with your long-term well-being. Understanding yourself, your motivations, and your expectations forms the foundation for a successful and fulfilling surgical experience. Neglecting proper post-operative care is one of the most common mistakes people make after cosmetic surgery, yet it is also one of the most critical factors in achieving a successful outcome. The surgery itself, no matter how expertly performed, is only one part of the process. How you care for your body afterward can determine whether you recover smoothly or face complications that could have been avoided entirely. Many patients underestimate the time, attention, and diligence required during the recovery period. Following your surgeon's instructions is not optional. It is essential for proper healing. Every procedure comes with specific guidelines designed to protect the surgical site, prevent infection, manage pain, and reduce swelling. Ignoring these instructions, even in minor ways, can prolong recovery or compromise results. This includes taking prescribed medications on schedule, keeping incisions clean, avoiding activities that could strain or injure the area, and attending all recommended follow-up appointments. Skipping any of these steps is not just risky. It can undo the work of the surgery entirely. Another key aspect of post-operative care is understanding the realistic timeline of recovery. Many people expect immediate results, but healing takes time. Swelling, bruising, and temporary discomfort are normal and should be anticipated. Impatience or frustration can lead to premature activity or neglect of instructions, which may result in complications or setbacks. Planning ahead for this period is critical, including arranging for time off work, organizing household support, and preparing for any restrictions on mobility or daily tasks. Nutrition, hydration, and overall physical health also play a major role in recovery. Proper diet and adequate rest support the body's healing processes, while smoking, alcohol, or neglecting sleep can hinder recovery and increase the risk of complications. Patients who ignore these factors often find that their results are delayed or suboptimal. Emotional readiness is equally important during this phase. Recovery can be physically uncomfortable and mentally challenging, particularly when results are not immediately visible. Understanding that the final outcome will take time can help prevent anxiety, disappointment, or impulsive decisions to undergo additional procedures prematurely. Communication with your surgeon is another critical component of post-operative care. Any unusual symptoms, signs of infection, or concerns about healing should be reported promptly. Patients who attempt to tough it out or avoid follow-up appointments put themselves at unnecessary risk. The post-operative phase is also the time to carefully follow lifestyle restrictions specific to the procedure, such as avoiding sun exposure, refraining from heavy exercise, or limiting certain medications or supplements that could affect healing. Failing to adhere to these recommendations can negatively impact the aesthetic results and even lead to permanent damage. In short, post-operative care is not merely a set of suggestions. It is a structured plan designed to ensure the best possible outcome. Patients who take it seriously, follow instructions diligently, and maintain realistic expectations about the healing process greatly increase their chances of achieving safe, satisfying, and long-lasting results. Understanding that surgery is only one step in a larger process encourages patients to approach recovery with patience, care, and responsibility, ensuring that the time, effort, and investment put into the procedure are fully realized. Setting realistic expectations is one of the most crucial elements of a positive cosmetic surgery experience. Many individuals approach surgery with the belief that changing a physical feature will completely transform their lives, solve insecurities, or suddenly create confidence and emotional fulfillment. While cosmetic surgery can make meaningful improvements, it has limitations and cannot alter deeper psychological or social issues. When expectations are unrealistic, even technically successful results may feel disappointing because they fail to align with an idealized image that could never be achieved through surgical means alone. Understanding what the procedure can and cannot do is essential. Every surgery has structural limitations based on anatomy, skin elasticity, age, bone structure, and overall health. A patient may bring in a photo of a celebrity or influencer as inspiration, but expecting identical results is unrealistic because everyone's body responds differently to surgical techniques. Surgeons can enhance, refine, and correct, but they cannot reshape genetics or replicate another person's features exactly. A healthy mindset involves aiming for improvement rather than perfection. Another key part of managing expectations is understanding the natural progression of healing. Results are rarely immediate. Swelling, bruising, tissue adjustment, and gradual settling all contribute to the final appearance over time. Some procedures may take months or even a full year to reveal their true final outcome. People who expect instant transformation may react emotionally during the early recovery stages, believing the procedure has failed when the body simply needs time to heal. When expectations are grounded in patience and knowledge of the healing process, individuals are more prepared and emotionally stable throughout recovery. Communication with the surgeon also plays a major role in forming realistic expectations. A qualified professional will provide a clear explanation of likely outcomes, potential risks, and what level of change is medically feasible. Patients who are honest about what they want and open to professional guidance are more likely to feel satisfied with their results. On the other hand, individuals who ignore professional advice and demand dramatic, unnatural changes may leave disappointed or pursue unnecessary revisions. Collaboration rather than assumption creates a balanced perspective and supports better decision making. A realistic mindset also involves understanding that cosmetic surgery can enhance confidence, but does not replace inner work. True self-esteem is built through self-acceptance, personal growth, and emotional resilience. Surgery may boost confidence by addressing a feature that causes discomfort or insecurity, but it is most effective when combined with a healthy relationship to body image. People who seek surgery as a way to gain validation from others often struggle with continued dissatisfaction, whereas those who pursue it for personal reasons experience more meaningful improvement in self-perception. Social media has contributed greatly to distorted expectations. Filters, retouched images, and selective presentation can make certain appearances seem normal or easily achievable, even though they are digitally manufactured. Recognizing the difference between reality and digitally altered beauty standards is essential when considering surgery. Maintaining realistic expectations ensures that results are appreciated for what they are, an enhancement, not a transformation into an unattainable ideal. Grounded expectations empower individuals to approach cosmetic surgery with clarity, confidence, and long-term satisfaction. Avoiding decisions driven by social pressure is essential when considering cosmetic surgery, yet many people underestimate how influence from others can shape their choices without them even realizing it. In today's world, appearance is constantly evaluated, compared, and displayed through social media, peer interactions, and cultural expectations. As a result, individuals may feel pressured to change their appearance not because they genuinely want to, but because they feel obligated to fit in or match certain beauty standards. When cosmetic surgery stems from external expectations rather than personal desire, it often leads to dissatisfaction and regret because the motivation behind the change is not rooted in self-acceptance or authentic personal goals. Decisions based on comparison or validation tend to shift over time, especially because trends in beauty evolve quickly. meaning something that seems desirable today may not hold the same value in the future. Social media greatly magnifies this pressure by promoting filtered appearances, edited photos, and influencer-driven beauty trends that can distort perceptions of what is normal or achievable. Constant exposure to these curated images may create a sense of inadequacy, convincing individuals that their natural appearance is not enough. However, many of these images are digitally altered, surgically enhanced, or presented in controlled lighting, making them an unrealistic target to pursue through medical procedures. When decisions are made to match an artificial standard, the outcome rarely leads to fulfillment. Recognizing the difference between personal desire and societal conditioning is a key part of making a grounded, healthy decision about cosmetic surgery. The influence of friends, partners, family members, and even coworkers can also play a significant role. Sometimes subtle comments suggesting a nose job, lip fillers, or weight reduction surgery may push someone to consider a procedure they had never thought about. In other cases, individuals may feel compelled to undergo surgery to maintain social relevance or to compete with peers who have already chosen to alter their appearance. While feedback from others can be useful when thoughtful and supportive, decisions based on pleasing or impressing others rarely lead to a sense of empowerment. True satisfaction comes from choosing a procedure that aligns with personal identity rather than external approval. Another aspect of social pressure arises when individuals choose surgery as a response to emotional strain or insecurity triggered by comparison. This type of influence can create a cycle where the individual continually seeks additional procedures to meet ever-changing external expectations. When cosmetic surgery becomes a coping mechanism rather than a well-considered choice, it can lead to ongoing dissatisfaction, financial strain, and emotional instability. Taking time to reflect on whether a decision feels internally motivated or externally influenced is crucial to breaking this cycle. Making a decision independent of social pressure requires confidence, self-awareness, and patience. It involves asking yourself whether the desire for surgery would still exist if no one else ever saw the results. It also requires recognizing that beauty is highly subjective and deeply personal. When cosmetic surgery reflects an authentic desire for self-improvement rather than an attempt to meet external standards, the outcome is far more likely to feel meaningful and fulfilling.